The clock above the AR doors read 3:19 when Dr. Nadia Voss looked at me over her mask and said, "If you touch my instrument tray again without being asked, you will finish this shift in the parking lot." I was 25, 6 weeks into my first job as a scrub nurse at Corrigan Regional, and I had just handed her a clamp a half second before she'd asked for it, thinking I was being helpful. My hands were still steady from the adrenaline of the trauma page that had pulled both of us out of separate beds an hour earlier. A delivery van and a motorcycle, 2 patients, 1 OR free. I remember standing there under those lights, feeling about 6 inches tall, and thinking, so this is the surgeon the whole hospital calls the freezer. That was the start of the worst, longest, strangest night of my career, and by the time the sun came up over the ambulance bay, I didn't hate her anymore. I'm not sure hate was ever really the right word. But it took 12 hours, 2 dying men, and one truth she'd been hiding under all that ice for me to understand what I was actually looking at. Corrigan Regional is the kind of small hospital where everybody knows everybody's business by the second week. And what everybody knew about Dr. Voss was this: she didn't smile, she didn't small talk, she didn't remember your name until you'd survived at least a month, and she had reduced 2 residents to tears in front of witnesses. The older nurses said she used to be different before something happened, though nobody would tell me what. I filed her under difficult and tried to stay out of her way, which is hard to do when the schedule board pairs you together for a 12-hour overnight because the other scrub nurse called in with the flu. The van driver was named Owen Petrossian, 31 years old, and he'd taken the worst of it. Internal bleeding we couldn't fully see the shape of yet, blood pressure sliding no matter what we ran into him. The motorcyclist, a woman named Grace Del Vecchio, 22, had a shattered leg and a concussion and, worse, no family anyone could reach yet, just a phone in her jacket pocket buzzing with unanswered calls from someone named Mom. "We don't have a second surgeon until 7, the charge nurse told us, already halfway back into her own emergency. "You two are it." Dr. Voss didn't argue. She just pulled her hair back tighter and said, "Then we don't stop." And for the first 3 hours, that's exactly what we did. I fetched, I suctioned, I called out numbers, and she worked on Owen like she was diffusing something that might go off if her hands slowed down. She barely spoke except to give instructions, flat and clipped, and when I fumbled a suture pass because my fingers had gone numb from adrenaline crash, she didn't yell. She just said, "Breathe out, then do it," quiet enough that only I heard it, and I did, and it worked. Somewhere around 5 in the morning, Owen stabilized enough for us to hand him to recovery, and we had maybe 11 minutes before Grace needed us in the next room. I found Dr. Voss in the scrub hallway, gloves off, forehead against the tile wall, not moving. "You okay?" I asked, because I didn't know what else to say to a woman who wasn't supposed to have a breaking point. "I don't get to not be okay for another 6 hours," she said, without turning around. "Neither do you. I almost left it there. I probably should have." But something made me say, my mother used to tell me the people who look the coldest are usually just the ones who learn that falling apart doesn't help anybody in the room. I don't know why I said it. Maybe because I was exhausted enough to stop being careful. She turned around then, and for 1 second, one single second, I saw something underneath the ice, something tired and human and almost afraid. "Your mother sounds smart," she said. Then the mask came back down, and we went to work on Grace. That's when the night stopped being about hating her and started being about something I didn't have a name for yet. Grace's surgery was harder than either of us expected, and halfway through, the monitors screamed in a way that meant we were losing her. I watched Dr. Voss's hands go from precise to something faster, more urgent, her voice climbing for the first time all night as she called for more units of blood, more hands, more time we didn't have. I have never in my life been more scared standing still. And I have never seen anyone fight harder for a stranger than she fought for Grace Del Vecchio in that room. When the bleeding finally slowed and the numbers climbed back where they belonged, Dr. Voss stood there for a moment with her bloody gloved hands shaking just slightly and said, so quiet I almost missed it. "Not tonight. Not another one tonight." I understood then, the way you understand something in your body before your mind catches up, that this woman carried every patient she'd ever lost stacked up somewhere behind her ribs, and the coldness wasn't the absence of feeling. It was a wall built by someone who'd felt too much, once, and couldn't survive feeling it twice. I wondered, and I still wonder, whether that makes her the strongest person I've ever worked with or the loneliest one. Maybe both. Maybe you can't have one without the other in a job like ours, and I think that's worth sitting with rather than answering. We finished at 7:40 in the morning, an hour late, both of us wrecked. In the locker room, she handed me a coffee she must have grabbed from the machine without me noticing and said, "You didn't fold tonight. Most first years fold. It wasn't warm, exactly, but it wasn't ice either." "I thought you hated me," I said, too tired to filter it. "I don't hate anyone I have to trust with a scalpel at 3 in the morning," she said. "I just don't waste energy pretending it's easy when it isn't." That was 4 months ago. She still isn't warm, not the way people mean when they say that word, and I've stopped waiting for her to be. But some mornings now, when a shift ends and we're both standing in that same hallway smelling like antiseptic and old coffee, she'll bump her shoulder against mine, just once, like a question she's still learning how to ask out loud, and I'll bump it back, like an answer. I think about that first night sometimes. The clamp I handed her too soon, the wall against the tile, the 2 lives we didn't lose. And I wonder how many people we misjudge in the first hour simply because we caught them at their most guarded and never stayed long enough to see what they were guarding.